Hello, and welcome to today's episode, in which we will be concluding on the documentation of acoustical analysis. It mathematically estimates the risks of benefit and harm coming from high quality research on population samples to provide information for clinical decision making for diagnosis and treatment of patients. The outcome of such studies is the development of an evidence based practice that aims at the generalization of medical procedures. In evidence based research, there are three levels, with the lowest level being opinions of authorities and the highest from properly designed randomized control trials. Note that level 2 has three subcategories. They conducted a systematic search of the literature on preventing voice disorders in adults. They then appraised the quality of the studies found and combined the results. They found 6 studies which met the inclusion criteria. 4 were conducted with teachers, 1 with student teachers, and 1 with telemarketers. They found no evidence that either direct or indirect voice training, nor the two combined, are effective in improving vocal functioning when measured using self reported outcomes and when compared to no intervention. All the included studies were small and of low methodological quality. Given the extent of the problem and the widespread use of voice training, further research is warranted. In our Cochrane review, it was shocking to see that following the Cochrane Handbook criteria for good research, very little could be used. We first made the Cochrane review in 2001 and updated in 7, 9, and finally in 12 in an effort to assess the effectiveness of surgery versus non-surgical interventions for vocal cord nodules. We searched the Cochrane Ear, Nose, and Throat Disorders Group Trials Register, the Cochrane Central Register of Control Trials, PubMed, Embase, Web of Science, Biosis Previews, Cambridge Scientific Abstracts, and additional sources for published and unpublished trials. The date of the most recent search was the 9th of April 2012. The selection criteria was randomized and quasi-randomized trials comparing any surgical intervention for vocal cord nodules with non-surgical treatment or no treatment. Our results were that no studies fulfilled the inclusion criteria. Fortunately, since we made our review, there has been several randomized control trials referred to in the Cochrane library on specific topics of voice. But meta-analysis has not shown any usable results. Thank you for watching, and we'll see you in the next one.